Today, we are diving into a really fascinating, kind of mind-bending idea. One that connects our most private, weird, wonderful experiences, our dreams, to the health of our entire community. So let's just start with a pretty provocative question that gets right to the heart of this. You almost certainly had a dream last night, but what if that dream wasn't just about you?
What if our dreams, when you look at them all together, are more than just personal stories? What if they're actually picking up on the collective mood of our society, like a secret signal hidden in the noise of our sleep?
Okay, so you're probably thinking, how on earth could you measure something as wild and personal as a dream? It sounds impossible, right? Well, it turns out there's a system for it, and it starts by breaking a dream down into its core parts.
It all works along 5 key axes. First up is the emotional axis. This one's pretty straightforward. It just measures the overall vibe of the dream. Is it filled with things like fear and helplessness, or is it more on the side of pleasure, affection, and calm?
Next, you've got the cognitive axis. This looks at the dream's, its logic. Is it all just confusion and chaos, or is the dream actually moving towards some kind of insight or resolution? Is it solving a puzzle, or is the mystery just getting deeper?
The third axis is all about our social connections in the dream. Are we feeling isolated, maybe facing hostility from others? Or are we experiencing real cooperation, empathy, and a sense of belonging?
Then there's the directional axis, which is really cool. It tracks the dream's momentum. Are you falling, going backward, feeling totally paralyzed? That's what they call a downflow. Or are you rising up, taking charge, maybe even rescuing someone? That's an upflow. And finally, we have the symbolic axis. This measures how complex the dream's language is. Is it just raw images and sensations, like the color red or the feeling of falling? Or is the dream weaving those things into bigger, more abstract, or even spiritual ideas? So when you take a person's scores from all 5 of those axes, and you average them out over a bunch of dreams, you get what's called the Mean Dream Theme Index, or MDTI for short. You can think of it like a unique dream fingerprint for that person. It shows their usual state of mind when they're asleep.
Okay, so that's the individual, a single dream fingerprint. But this is where it gets really, really interesting. We're going to zoom out now, from just one person to an entire community. If you gather thousands of these individual dream fingerprints, you can actually calculate the average dream of a whole city or a whole community. It gives you this incredible center of gravity, a snapshot of the collective mood. Is this community, on average, feeling anxious or calm, connected or isolated? The dreams of the many start to reveal the emotional truth of the whole.
But, and this is absolutely the key, it's not just the average dream that tells the story. The real secret sauce is in how much everyone's dreams differ from that average. And for that, we use a pretty simple statistical tool called standard deviation.
And here it is. This is the big reveal. This is where a simple concept from statistics tells us something incredibly profound about our shared mental health. The secret is all hidden in the spread of our dreams. So if the spread, the standard deviation, is low, it means most people are having pretty similar dreams. They're all clustered together. That's a huge signal of a coherent, psychologically healthy community, a group of people who are emotionally in sync, sharing a reality.
But what if that spread is high? Well, that means everyone's dreams are all over the map. You've got nightmares of loneliness over here, anxiety dreams about falling over there, and serene dreams of teamwork somewhere else. This points to a fragmented society, a community that's under a lot of stress or maybe even deeply polarized. We can actually take this idea and turn it into a single, easy-to-read number, the Community Dream Health Index, or CDHI. It's a simple formula that turns that dream spread into a health score. If the score is close to 1.0, you're looking at a healthy, coherent community. But if it drops down near 0.2, that's a serious warning sign. That's a community in crisis. So, this is all great in theory, but what can we actually do with it? What can this new metric, this sort of inner weather report for a city, really tell us about the world we live in?
Well, this chart here just lays it all out. It shows you the link between the raw numbers and what they mean in the real world. At the very top, with a high score, you've got a harmonious, creative community. As that number drops, you move through mild strain, then into a polarized and stressed society, and at the bottom, you're looking at a state of crisis.
And visually, the difference is just stark. Look at City A on the left, with that high score of 0.9. Its citizens are basically dreaming in sync. They are emotionally coherent. Then you look at City B on the right, with a score of 0.2. Its dreamscape is completely fragmented. That's a clear, loud signal of widespread psychological distress.
You know, this one sentence from the source material just perfectly captures the whole idea. The point here isn't just to crunch a bunch of numbers. It's about finding a whole new way to listen, a way to hear the subtle whispers of a city's collective soul.
And the potential applications here are just profound. I mean, imagine being able to track collective stress to predict a crisis before it happens, or being able to genuinely measure if a big public health program is actually improving people's well-being. It could even be used to build more empathetic AI. The possibilities are truly fascinating.
So this amazing tool really bridges our most private imaginations with public health, our inner lives with the world outside. But it does leave us with a pretty powerful question to chew on. If we actually had the ability to read our collective dream, should we?